From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Shipman. The coronavirus has many people concerned and finding ways to prevent contracting the disease, but some of us still have other health issues that we're dealing with. And what if you have a life-threatening emergency? So today on 22 News in Focus, we're going to help you find the best ways to access health care that's not related to COVID-19. So joining me to talk about this, about healthcare treatment alternatives, is Dr. Sadi Mitiat. Let me say it properly, Miattinen. We practiced before too, didn't we? A pediatrician and medical director of Cooley Dickinson Medical Group. So thanks for coming on the program. And I want to start off with testing. Is Cooley Dickinson providing any testing or treatment for COVID-19?
Absolutely. So we offer outpatient testing through our drive-through, and that testing is actually coordinated through a patient's primary care provider. So it's by appointment only. And the way that a patient accesses that care is that they call their primary care provider if they feel that they're experiencing symptoms of COVID, and their primary care provider contacts us in our respiratory illness clinic to then arrange that testing, again, by appointment. And we conduct that testing through a drive-through mechanism that you've probably seen a lot in public in order to protect not only the patient, but also to protect our healthcare workers who are fully equipped with personal protective equipment.
So what is the COVID-19 Community Call Center and what does that offer?
Sure. So the community call line offers several resources for our community. The first type of call that we've seen coming in are community members that are looking to donate either supplies like personal protective equipment or local businesses looking to donate food for our healthcare workers. The second type of call that we get are just general questions about COVID, whether someone's experiencing COVID symptoms or they have questions about social distancing, proper hand washing, use of surgical masks or homemade masks. And the third type of call we get are patients that are looking for a primary care provider. Because in this era of COVID, we've had to completely redesign the way that we deliver healthcare, as you mentioned, for not only our COVID patients, but also for our non-COVID patients. And the main way to access care these days is through a primary care provider. So for those members of our community who don't have a primary care provider, that's the main way for them to locate one. And we have 9 practices, all of which are accepting new patients.
And you know, people are concerned about staying connected with healthcare providers. How effective are those telephone and even video appointments? Do they work?
Yeah, absolutely. So this is new for everyone, right? So not only for patients, but also for the healthcare community. So we were all used to accessing and providing care in one type of way prior to COVID. And that typically involved a patient presenting either to our primary care offices, to an urgent care, or to an emergency room. Nowadays, we've found 3 common themes. We found that patients don't know how to access care. Secondly, they may be afraid to access care. And third, we found that some patients are accessing care later in their illness than they really should have. So the first line of defense is really to call your primary care provider and have what we call a telephone or a video visit. That is what encompasses telemedicine. And during that telephone or that video visit, you and your primary care provider can discuss your concern and come up with a plan together. And at the end of that plan, there may be several choices. If you do have a COVID-related concern, you might be directed to our respiratory illness clinic where you can be seen and examined in, again, a very safe environment. The second option is if you have a non-COVID related illness or acute or short-term concern, something new like belly pain or perhaps a migraine, those might actually be appropriate to come into your regular primary care office. Then, of course, there are the chronic illnesses or long-term conditions that many of our patients have, which include diabetes, COPD, some congestive heart failure, or even for our patients who are expectant mothers. And for those patients, again, the initial visit is via the telemedicine or the video visit. And at that time, you two participate in what we call a shared decision, and you decide whether this is something that can be managed at home or should be seen in one of the other mechanisms that I mentioned.
Are any primary care providers still providing, regular office hours? Like, how does that work?
Yeah. So our offices are still staffed during their regular hours that they had prior to COVID-19. But again, we've just redesigned the way that we're staffing. So it's not only important to maintain social distancing when you're out in the community, but it's also important to maintain social distancing in the practices. And so we have scaled back our staff and our providers so that there are always providers in the office and always staff in the office to handle any of your needs. And then we've redeployed some of our staff and providers to their homes to conduct telemedicine visits there. All of our providers and staff, when they enter any of our facilities, either the hospital or an outpatient clinic, wear surgical masks at all times, unless, of course, they're having lunch. And we see patients, again, who need to be seen. But those telephone numbers are still working. The regular office hours, and we've actually expanded some hours. So one theory about expanding hours is if we can expand hours that our patients can contact us, maybe they will be less tempted to use the emergency room or an urgent care center where they might be exposed unnecessarily to COVID symptoms. And so, for example, our orthopedic office is now doing something called a walk-in injury clinic, 7 days a week, where patients can present for what Dr. Fallon likes to call broken bones, bent things, or things generally pointing in the wrong direction. And then, of course, Dr. Topal, our plastic surgeon, who is willing to take walk-in appointments for other types of soft tissue injuries, things like cuts, burns, or skin infections.
All right, Dr. Miettinen, thank you. And we're going to continue our conversation after the break. You're watching 22 News in Focus. We're back, 22 News in Focus. Today we're talking about non-COVID-19 healthcare treatment options, and joining us here is Dr. Sadi Miettinen, a pediatrician and the medical director of Cooley Dickinson Medical Group. So a lot of people have underlying conditions, they have other conditions. We're all concerned about COVID-19. People are still being diagnosed and they're being treated for other diseases and chronic illnesses such as cancer, I think of first. What is the protocol for patients who need to come to the hospital, say for chemotherapy or dialysis? Radiation too.
Absolutely. So we're here to provide all of those services, again, as we normally would, just in a slightly different way. So when patients are first calling for appointments, the providers will make sure that those appointments are medically necessary at this time. And if they are necessary, we do ask all patients about whether or not they're having any COVID symptoms. So symptoms such as fever, cough, shortness of breath, a new sore throat, or new nausea or diarrhea. And if patients are having symptoms, then we make the decision about whether or not we can defer their care, even simply for a few days until they're feeling better. If that is not an option, we do have the ability to do something called rapid testing here at Cooley Dickinson. And that involves a rapid COVID test that we can have results in less than an hour. Therefore, we can make sure that we're providing our patients, again, a safe environment where they are protected and our staff is protected and the proper personal protective equipment during their visit. When patients do present for their appointment, they're again screened for any new symptoms that may have occurred since we last spoke with them. Every patient who enters our facility is required to wear a surgical mask, and they're supplied that mask when they enter the doors. And then again, all of our staff is also wearing masks as well.
You know, a lot of hospitals too are canceling elective surgery. So how does a doctor decide which surgeries are necessary?
Yeah. So we follow the recommendation of the American College of Surgeons, and their definition for an elective surgery is something that could possibly wait for 4 weeks or more. So if we have a type of surgery that would need to happen in less than 4 weeks, again, we're screening our patients for symptoms. And then anyone who's being admitted to the hospital will receive one of these rapid COVID tests so that we can make sure that they're placed in the proper type of room. So if we have someone who is screening positive, they would require something we call a negative pressure room. Other patients who are screening negative, as long as they remain without symptoms, can be placed in a room on one of our regular floors.
And you mentioned when a patient comes to the hospital, they would be given a mask. What are some of the other protective protocols that you have in place for someone who's admitted to the hospital?
Sure. So for our emergency departments, again, as patients are coming in, they're immediately screened for symptoms and placed into appropriate rooms. Our staff, again, are masked at all times to protect the patients and themselves. And then anyone who is hospitalized and does develop symptoms will have one of these rapid tests so we can immediately determine whether or not they need special isolation or not. And then again, anyone walking into our facility is asked to wear a mask. And we also ask that people not bring visitors with them. So if you're having an appointment and you're able to come to your appointment without assistance, we ask that you come without a visitor, except for in special cases. For example, if we are having patients who are at the end of life, or if we are having expectant mothers who are delivering, we do allow special cases for visitors in those circumstances.
Yeah, women are continuing to have babies, obviously. What is being done to provide prenatal treatment? And I've heard a lot of stories, too, where some women are afraid to come to the hospital. They don't want to, they think they're going to get sick. It's, they're kind of weighing their risk back and forth here. What do you say to them?
Yeah, absolutely. So our prenatal care continues as it had normally continued. For low-risk pregnancies, if we are able to consolidate appointments, for example, if you're due for an ultrasound and you're also due for a regular office visit, which would normally be spaced out by, let's say, 4 weeks, we might be able to space those out by 6 weeks. So we're doing a little bit of spacing if you have a low-risk pregnancy. For those patients who have high-risk pregnancies, we still want to be able to see you so that we can take care of that high-risk pregnancy and make sure that you have the healthiest pregnancy possible. We are also able, again, in our women's health clinic to do televisits and virtual or video visits as well. And then when patients are coming in for labor, they are actually offered a COVID test, whether they have symptoms or not. So this is a special population where we are actually fortunate enough to have enough testing supply to test those patients who don't have symptoms. If they bring a support person in with them, those support persons are also provided a mask, and they're asked to stay throughout the duration of the labor and delivery. We don't want them going back out into the public and re-entering the facility so that they don't catch anything when they're out in the community and then bring it back into the hospital.
So for example, what happens if a pregnant mother who is delivering does test positive for COVID-19,
Sure.
delivers the baby, is there a separation there?
So there are recommendations, and we have to always remember that these are recommendations. And so our OB-GYNs and our midwives, they present these recommendations to the parent, which do actually include, yes, some separation and keeping a 6-foot distance and hand expressing milk. And then again, it's a shared decision between the OB-GYN or the midwife and the parents or parent about what's best for their child.
What is the risk, though, in all of that? I mean, because there's so many things to consider, because those are really precious bonding moments, too, to take into consideration.
Absolutely.
And what is that conversation like? Because I just wonder, that's got to be so emotional and sad in many respects for a mom.
Yeah, absolutely. And so the conversations are difficult, but they're honest. We just want everyone to make the best decisions, again, for themselves and for their infants. And we fully support our moms and our babies in what is best for them. And I think that our staff here and our providers here are absolutely incredible in having those conversations. And we're learning with the rest of the community and the patients as we all go along.
Yeah, what a reality check in all of this, because it is such it can be emotional in general, that whole process, and then to put this in the middle of it, it's got to be tough. All right, we want to continue our conversation here. When we return, we're going to talk about outpatient programs and medical resources. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about non-coronavirus related healthcare options with Dr. Miettinen. And Cooley Dickinson offers visiting nurses and hospice programs, which requires home visits. Are those still going on?
Absolutely. And so just like with any kind of outpatient appointment, we want to assess the type of visit and the patient's condition and the reason for that home visit. And again, if between the patient and the VNA that visit is deemed critical, we will absolutely go out to the home regardless of COVID status. That COVID status just helps inform, again, what type of personal protective equipment our staff should be wearing when they enter the home. And so there may be cases where someone has been receiving VNA services and they're close to discharge, and maybe they could have their last few appointments via telephone, and if that's appropriate, that's what we'll do. And if they have a more critical need, for example, they've just been discharged from the hospital, they require IV medications or some type of wound care, we again will contact the patient and ask if anyone is having any types of symptoms in the home. So this would apply not only to the patient, but to anyone else who lives in the home with them. And when our nurses enter the home, they'll be wearing their appropriate PPE. And then we ask that all family members, again, if possible, maintain that social distancing during the appointment.
And people who are recovering from, say, heart attacks, strokes, orthopedic surgeries too, they require rehabilitation services. What's being done to help people in these recovery processes?
Sure. So we have 5 rehab facilities that continue to see patients, and they provide, the physical therapy, occupational therapy, and we do the same assessment. Is this appointment something that's needed right now? For example, someone who's just come out of surgery or just been discharged from the hospital and needs some rehab services. And if it is, they are brought into the clinic for their initial assessment, and then after their initial assessment, if they're able to do their PT sessions or their occupational therapy sessions with the therapist via video conference, we can actually do their therapies at home with them. And we've also been able to space out some of our visits. So as patients have not wanted to access healthcare, like you originally mentioned, we're able to space out our appointments and so that there's appropriate social distancing between our patients when they are in the rehab facilities.
Your hospital, other hospitals too, offer many different types of, support groups and stuff. And I would suspect that they're definitely needed now. Are these continuing online or say by phone conferencing?
Yeah, absolutely. So on our website, CooleyDickinson.org, you'll see the homepage is dedicated to COVID, and linking on the right-hand side is a link to community resources. And there are 25 community resources there that are listed that have, as you said, remote capabilities to provide support. Another option, if someone is looking for these type of support groups, is again to call our community line, which is listed on the web page as well. It's 1-888-554-4234. And at that phone number, they can also help link you to any type of support group or resources that you might need.
And then mental health crisis, they continue. A lot of hospitals are seeing an increase actually in people who are experiencing anxiety, say panic attacks. How's the hospital addressing mental health services?
Sure. One of the things that we've actually seen an increase in is not so much the anxiety and the depression, but actually this social isolation. It's really challenging for a lot of people at this time. And so if patients present to the hospital and they're having any type of mental health crisis, we do have a partnership with CSO in our community who provides evaluation for those patients. We, of course, have still our inpatient psychiatric unit. And then again, all the support groups that I mentioned on our website that have video capability to have sessions.
And then domestic violence, it's on the rise. We've done stories on this a number of times here. It's across the country, really. Has the hospital or any of its affiliated practices seen an increase in demand for services for abuse protections?
Yeah, I think along with many places that are reporting across the state, We actually are hearing less about it. And again, the theory here is that as patients or families are social distancing and they're not able to leave their home, they're not able to access those resources. So if you're able to access your primary care provider or the community line, we're here for you anytime. And we would be more than happy to connect you to any type of support or resource in this time.
That's actually concerning to me. I mean, if I'm looking at this the same way, that means that the abuse is likely still happening, but that person that's being abused doesn't know how to get the help they can get or that's available to them.
Absolutely. Yeah, I fully agree. And I think, again, reports around the state have indicated similar observations.
And what about, say, substance abuse treatment? Have you noticed an increased need for that?
We have not locally actually noticed an increase for a need in those support services, but again, it may be that there's just a lack of access to the healthcare system right now. So again, those types of support services are also listed on our website and continue to be available to the community.
And if I'm a neighbor and I hear my neighbor, abuse happening nearby, what do I need to do?
Yeah, absolutely. You can notify your local police department, of course. You can also reach out to any of us here at the healthcare system, and we'd be more than happy to help connect you, the neighbor, with an appropriate resource.
All right. Thank you. We're going to have the last word right after a short break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about non-coronavirus related healthcare options with Dr. Sadi Miettinen from Cooley Dickinson Medical Group. So I want to thank you for coming on the program with us here. And that is our program today. Thanks for watching at home here. And if you missed this, you can watch the full version of it right on our website at wwlp.com. From all of us here at 22 News, have a good day.